Hi guys, welcome back to my channel. So today I'm going to read an article entitled When Health Insurance Doesn't Cover Your Bills. Health insurance is supposed to protect you from financial ruin in the event of a medical emergency. However, for millions of Americans, this definitely is not the case. According to the Commonwealth Fund Biennial Health Insurance Survey, 43.4% U.S. adults ages 19 to 64 were inadequately insured in 2020, as measured by high out-of-pocket costs and deductibles relative to income. More than a third of the group reported struggling to pay medical bills, and 35% were making installment payments on medical debt. Among those reporting problems with medical debt, 40% received a lower credit rating as a result, 37% exhausted savings, and 26% found themselves unable to pay for basic necessities. Medical debt is the most common collections item reported on consumer credit reports, and estimates for U.S. medical debt in collections range from 81 billion to 140 billion according to the Consumer Financial Protection Bureau or CFPB. 1 in 10 Americans owes $1,000 or more in medical debt. Consumers not saddled with medical debt may still struggle with excessive medical bills, exclude services, out-of-network providers, and excessive co-pays can leave even those with health insurance coverage coping with costly bills for medical care. Key takeaways: many people with health insurance struggle to pay their medical bills or have medical debt listed on their credit report with no other types of debt. There are steps you can take to reduce the risk of incurring high medical bills, including screening potential providers, confirming the accuracy of your insurance information, and requesting itemized bills. Should you face an exorbitant medical bill, you might consider making payment arrangement with your provider, inquiring about financial assistance programs, or negotiating the final balance. Amid a political push to minimize the burden of medical debt, consumer credit reporting agencies in March 2022 unveiled measures they say would remove nearly 70% of medical debt collections items from credit reports. How to curb costly medical expenses? Here are some tips for avoiding costly medical bills. The first is screen providers. Before receiving these services, confirm the provider that they are in your insurance plan's provider network. For more advanced services such as surgery, confirm that all participating providers are also in the network. Otherwise, you could incur hefty fees because out-of-network providers. Confirm the accuracy insurance information. Each time your health insurance changes, share the updated information with your provider so that your claims are not processed using the old policy still on file. If you don't, your claim will be rejected, and you may have to cover the cost of treatment. While it's fairly simple for the billing staff to resubmit the claim to your new insurance company, you could still end up the hot seat with the collection department if you don't get everything straightened out of time. Request itemized bill. Medical billing specialists process thousands of claims, so mistakes are bound to happen. Various groups have provided estimates about the extent of the problem, ranging from an error rate of 7.1% for the paid claims according to the American Medical Association to report of groups errors on up to 80% of claims from billing review groups as reported by CNBC. Compare quotes for services. Who says you cannot shop around for medical provider? In fact, the Affordable Care Act requires hospitals to list prices for all the services they provide. Unfortunately, a patient entering hospital treatment for an emergency medical conditions cannot possibly know what services will be needed, much less if they are available at a lower cost, elsewhere limiting the utility of such lists as comparison shopping lists. Make payment arrangement. Then negotiate the final balance. As a last report, you can meet with the billing administrator and attempt to negotiate the final balance. So that's all the article. Bye bye and see you on my next video.